nating learning fatigue. Naiintindihan pa ba? Ano yung reaction nila? Effective ba yung teaching? If yung learning environment, okay, i-observe mo. So, changing the teaching method when the patient looks confused, okay? Allowing child to self-inject insulin first if less fearful, okay? Adding more demonstration when learners struggle. So, these are the changes that can occur during a health teaching session, during your formative evaluation. So, sa process evaluation includes checking if the learner can ask question comfortably. Environment supports learning. If the teaching materials are understandable, naiintindihan ba if learners are actively involved. So technically, it helps prevent problem before it even gets worse. Okay, so that is your formative evaluation or process. But content evaluation determine whether learners gained the knowledge or skill taught. So ito kino-conduct immediately after the teaching. It measures what? Short-term learning outcomes. Did the learners learn from the information taught? Were the objective achieved? That is content evaluation. It focus more on what? The knowledge retention after the session. Skill performance, achievement ng learning objective. So anong methods usually ginagamit sa content evaluation? Return demonstration, post-test, quizzes, teach-back method, okay, skills checklist. These are all content evaluation that can be used. So example, patient demonstrate insulin injection correctly. Nurse complete a post-test after a seminar. Student answer questions after a lecture. Okay, so those are examples of your content. Now, when you say outcome evaluation or your summative, from the term summative, it measures the long-term effect of the teaching done after teaching is completed. So evaluation, whether teaching learning continues in real life situation and focus more on the behavioral changes and application of learning. Okay, so summative, from the term sum, what was the teaching effective? Did behavior change occur? Okay, were objective maintained over time? Okay, so gaya ng sinabi kanina, long-term effect of teaching. Okay, ang chinecheck mo sa summative evaluation. It measures continued use of skill, habit changes, long-term knowledge retention, and patient self-care performance. Okay, now example mo is patient correctly use insulin at home after discharge. Okay, not immediately after. Hindi, nung pagka-uwi niya. Nurse independently perform a newly skilled task in practice. Patient follow dietary restriction. So broad siya than your content evaluation because it looks at the lasting effect. So mas nade-determine if education truly improve patient outcome. Kaya outcome evaluation, kaya summative sinasummarize or sinasum mo all. Impact evaluation measure the overall effect of education on institution or community. So it determines whether a program is worth continuing, focus on large scale and long-term outcome, and evaluates whether goals of programs were achieved. So example, reduce yung hospital readmission rate after discharge, lower yung staff injury rates after body mechanics training, improve diabetes control in the community. So may yung impact, yung overall effect po. And then you have your total program evaluation, evaluates the entire education program or department. So yung overall goal or the overall goals achieved, mas pinaka-broadest and most comprehensive type of evaluation. So this one focus on the learner, teachers, educational activities, and the program outcome. Okay? So dito, ini-include mo yung evaluation ng apat. Na-included dito yung process, content, outcome, and impact po. Okay? Now, evaluation method refers to how data will be collected. So, ano ba yung type ng data? So, may quantitative ka. When you say quantitative, numerical data measured using statistics or numerical value, test score, blood pressure, attendance rate, frequency count. 90% of patients correctly demonstrate insulin injection. So, that is quantitative data. Qualitative data, descriptive siya, data based on feelings, opinions, behavior, and experience. Patient feedback, learner's experience, narrative comments. Provide deeper understanding and meaning pag qualitative. Patient express feeling more confident after teaching session. That's a qualitative data po. So, paano tayo nagko-collect ng data? Through observation, watching behavior or performing directly. Okay? Observing a patient injecting the insulin. That's an observation po. Okay? Interviews. Asking question verbally to gather information. Okay? Asking how confident they feel after teaching po. Question, written examination. So, written tools used to assess learning or opinion. So, post-test after a seminar po. Okay? Can be used. Record review, so you review charts, forms, or documentation, and secondary analysis of existing database. So, using already existing data for evaluation, yung mga records to compare readmission rates po. Now, in terms of the timing, okay, of data collection, so sa process evaluation conducted during the teaching, okay, monitoring learning participation during class, content evaluation conducted immediately after teaching, just like what we mentioned, outcome conducted after learners apply knowledge in real life situation, and impact conducted weeks, months, or years later, measuring decrease in hospital readmission rate. So, yun yung timing ng data collection mo. Okay? Now, what is evaluation outcome? So, it determines whether the teaching and learning were successful. So, tayo, as nurses, we assess if the patient learned correctly, kaya tayo nag-evaluate, methods are effective, if change in the teaching plans are needed. So, ano yung ina-evaluate natin? Learning, continuous and essential part of the teaching learning process. So, focus on determining whether the patient or learner understood and learned the intended information or skill. Pag evaluation of teaching, ang focus is assessing yung effectiveness ng nurses' teaching method and strategies. When objectives are not met, reassessment is necessary. Okay? Pag hindi na met yung objective mo. So you will modify, as what I've mentioned on the previous discussion, methods, materials, environment, pacing ng teaching, and even communication style if that is the one that nandun yung gap. Okay? So if the patient cannot correctly perform wound dressing, the nurse may repeat the demonstration, use visual aids, allow more hands-on practice, or simplify the instruction. Okay? Okay? So tandaan, pag evaluation ng learning, si learner ang focus, pag teaching method, okay, ni educator. Sa learning, determines if learning occurred. Sa teaching, determines if teaching was effective. Kapag sa evaluation ng learning, measures patient understanding and skill. Kapag sa evaluation ng teaching, measures quality of instruction. Example mo sa learning is return demonstration. Pag sa evaluation sa teaching, revising your teaching strategies. So in summary, evaluation outcome helps determine both the patient learning and teaching effectiveness. So evaluation should be ongoing and patient-centered. If not achieved, dapat ma-reassess and then you need to modify. So what are the barriers of evaluation? Okay, lack of clarity. So meaning, baka mamaya nag-lack ka ng, it occurs when the purpose and goals and process of evaluation are unclear or not fully defined po. So, ibig sabihin, you use vague terms like good quality, okay? Difficult to measure yon, so unclear yung objective, okay? Ano ibig sabihin ng good? Paano mo siya i-measure? Lack of ability happens when educators or evaluators lack the knowledge, okay? Hindi naman pala alam paano mag-evaluate in terms of knowledge, skills, confidence, and resources. Fear of punishment and self-esteem. So evaluation may be viewed as criticism or judgment for person's ability. So learners and educator may fear failure and embarrassment and punishment po. So paano tayo strategize to overcome fear during evaluation? Focus on the learning, not the punishment. So let's say, hindi niya nagawa ng tama. Instead of saying you did it wrong, okay, you can say, let's practice that step again together. Okay, this approach will encourage the patient and reduce yung anxiety. Okay po. Identify factors affecting the learning. So, bakit ba na-feeling let them? Masyado ba maingay? Yung instructions ba mahirap intindihin? Natatakot ba na kinakabahan ba yung patient? Okay, so you should identify these barriers. Encourage reinforcement. So again, that's self-explanatory. You give praise po. Explain the purpose of the evaluation. So make sure na, kasi yung return demonstration na to, make sure natin na kapag pauwi ka na, kaya nyo na po mag-inject ng insulin. And you protect privacy and confidentiality. Kapag nagpa-evaluate kayo, make sure na may mga patient information, data privacy po. Okay, hindi pa kalat-kalat. Okay, yung mga evaluation forms natin. Now, let's discuss documentation. Documentation refers to what? Accurate recording of the nursing care, patient education, assessment, intervention, and outcome. So for sure, na-discuss natin to sa fundamentals na discuss nyo. It is essential part of safe, legal, and evidence-based nursing practice. So ano yung importance ng documentation? Okay, so first, it supports safe and quality care, okay? So kapag well documented, okay, so we assured na nagawa natin ng tama yung health education natin. Facilitates communication. So meaning po, okay, kapag nagbasa si doc, nag-round siya, nakita na pala siya ng nurse educator for diabetes, okay? It provides legal protection. So in the event na nagkaroon ng kaso yung pasyente ninyo, pag chinek yung chart ninyo, well documented that you teach health teaching, you provide health teaching in terms of fall risk, okay? Ano yung mga measures na ginawa mo? And demonstrate nursing contribution. So makikita doon na nag-contribute ka as a nurse sa pagkikare kay patient. Now, documentation in health education po, okay? Important information to document. Topics discuss. Ano yung assessment finding mo? Ano yung learning needs and readiness? Goal, teaching method, participation ni patient and response evaluation. Okay? So example, patient educate regarding wound care using demonstration and teach back method, correctly verbalize signs of infection and perform dressing change with minimal assistance. Okay? So nandun lahat ng elemento na nasa taas, complete documentation. Confidentiality, so it means protecting the privacy and security of the patient information. Very important to. I believe, for sure na-discuss din to sa inyong fundamentals. Okay? Patient information should only be shared with authorized healthcare team directly involved sa care. It should be stored securely and protected from unauthorized access. Okay? So let's say health education mo. Okay? Medyo sensitive yung case ni patient. Okay? Tapos pakalat-kalat yung health education mo na plan. Okay? So malalaman, si bed ganito pala, may ganito kasi binibigyan siya ng education about this disease. Okay? So very important yung confidentiality. So essential characteristic of nursing documentation, which you discuss for sure, is what? Nursing documentation should be factual, okay? Meaning it should only you document only factual, okay, information based sa first-hand observation, assessment mo, actual condition ni patient. Avoid personal opinions, assumption, judgment, and statement, okay? Let's say patient report, pain level of 7 out of 10, okay? And guarding noted on movement. Hindi mo pwedeng i-chart na patient is exaggerating pain. Accurate and relevant documentation should be correct, precise, directly related sa patient care. Information must be clearly and easy to understand, okay? Important details only. Avoid yung vague or incomplete statement, okay? Which leads us to next. Complete dapat yung documentation, okay? Lahat ng elements dapat nandoon. Current dapat, so dapat updated immediately as soon as possible after the care is given, okay? Hindi yung i-chart mo siya bago ka umuwi. And organized, logical, and sequential, okay? Dapat hindi slow-paced, okay? Hindi nauna yung pang alas 10 sa pang alas 8, okay? Or nauna yung implementation bago sa assessment. And then, compliant with standards of practice in legal requirements. Again, uulitin ko po, ang documentation nyo is your That's your protection po in case na magkaroon ng legal battle or magkakaroon ng case for a specific patient. So especially kahit sa ang part, okay, not just health education, even sa nursing, sa interventions natin on our day-to-day duties, okay? So again, I would like to emphasize this is the complete teaching plan. So if you check the template of our health teaching plan, you will see yung mga elements na to. So there's a purpose, a statement of the goal, list of the objective, outline of the related content, instructional methods, time allotment, instructional resources, and methods used to evaluate learning. Okay, and with that, we are done discussing implementation, evaluation, and documentation. Thank you.